Within the UF i2b2 data hierarchy, some data elements are represented by modifiers. Modifiers provide additional information about a given data element and allow you to make more precise queries. For example, within the ICD-9 diagnosis hierarchy, our designers use modifiers to represent additional information about a particular diagnosis, such as whether that diagnosis was coded on a financial bill or whether it was coded in a patient's problem list. In the UF i2b2 system, diagnosis codes have other modifiers as well, such as those to identify if an inpatient diagnosis was coded as present on admission. You will also find modifiers within the Recontact for Research Studies folders and within other folders. Graphically, modifiers are represented by a blue circle when you drill down into the folders and to the leaf level for some data elements. However, not all data elements have modifiers. Next, I will demonstrate how to use modifiers to query for hospitalized patients who have a diagnosis of a pressure ulcer that was not present on admission. In other words, we are interested in patients who developed pressure ulcers while in the hospital. I'll start by maximizing the Navigate Terms panel. Then I'll go into the Diagnoses folder, into the ICD-9 CM folder, and then down into the folder where we can find pressure ulcers. You'll notice as we start to navigate into these folders, some subfolders have a blue circle. These indicate modifiers. When we go into 707, which is chronic ulcer of skin, and then to 707.0, which is pressure ulcer, there are modifier folders represented here, and then individual modifiers when you get all the way down to the bottom level. So what I'm going to do is I'm going to grab the no for not present on admission, pressure ulcer, and drag this into group 1. This simple query will give me the number of patients who have a pressure ulcer coded on their record and that pressure ulcer was indicated as not present on admission. We run that query. And we get back 333 plus or minus 3 patients. We could clear that out and we could run a similar query except on present on admission yes, and this would give us the number of patients who had a pressure ulcer that was indicated as present on admission, meaning when the patient arrived at the hospital, it was determined that the pressure ulcer already existed. When we run that query, we get back 1,954 patients plus or minus 3. Together, these queries indicate that most pressure ulcers on hospitalized patients were present on admission as opposed to developing while the patient was hospitalized. You can see there are other modifiers that you can query on with respect to diagnoses, such as clinically undetermined or exempt. And as you continue to explore the UF i2b2 system, you'll find modifiers are available to allow more specific querying on a number of other data elements. This concludes the video on how to use i2b2 modifiers.